We will get started. Thank you guys for showing up, and this is being recorded for future replays. We will just jump right in. The name of this topic is, does your husband need to be on testosterone? And we will talk about this in tandem with, do you need to be on hormone replacement therapy? The words are still the same, the information is still the same. And so we'll talk about what the benefits are and things to consider. The first quote I had here was that married men live longer, married women don't. And I put that there first, thinking that was an encouraging thing for women to want to help their husbands live longer. But the reality is that it's just not fun for us to really be on hormone replacement therapy if our husbands aren't on hormone replacement therapy, because the things that we talk about for women are also happening for men. So we talk a lot about menopause for women, and we talk about all of the things that happen, the mood shifts, the energy shifts, the health shifts, the weight shifts, all of those things that happen for women also are happening for men, but we just don't talk about it. It actually has a term, and it's called andropause. And that essentially is where your testosterone level is dropping over time. And this happens for women. It happens with their estrogen, their progesterone, and their testosterone, and it happens in men as well. And because most men aren't aware of that, they may be experiencing a decline in their functionality, not just sexually, but also energetically, their mood shifts, their tolerance. All of these things can be affected as your testosterone decreases, and it starts to decrease in your 30s. So the question that I always ask men is, do you feel as well as you did in your 20s? Because that's when presumably you would have had the peak of your testosterone if you were healthy in your 20s. Now, there are some 20-year-olds who have low testosterone, and so it's even men as young as their 20s may need to have their testosterone checked. And I really encourage men to check their testosterone in their 20s, because that'll let you know, particularly if you're feeling vibrant, if you're energetic, you're able to do all the things, you're ambitious, all of those things are happening in your 20s, and you are, what am I doing here? If all of these things are happening in your 20s the way you would like them to, and then as you get into your 30s, you're just feeling a little bit less, who you want to be. And in your 40s, you start to just feel a little bit less, and it gradually sneaks up on you, and you may not even know it. And then you'll just think it's a part of aging, right? And it's not, in fact, a part of aging. It's a result of your testosterone dropping. What we may see first as women, but you may see this as well as men, and you may just be ignoring it, right? That you're exhausted all the time, that your sex life has either disappeared or it's just not what it used to be. So it doesn't mean that you are unable to perform. It just may not be what you're used to. You're more irritable, depressed, or you've just lost that mental edge. So you're not feeling as confident as you normally did when you were younger. You may also notice that your muscle mass starts to decrease, right? So it's easier for men to gain more muscle when they're younger and their testosterone levels are nice and high. And then as you get older, this is a natural part of aging. As your testosterone decreases, we've all seen it, where men become a lot softer around the midsection. They're not able to maintain as much of a muscle mass as they used to. And again, this isn't because you're not doing the right things. It's just that your testosterone isn't working for you the way that it could be. So these signs aren't normal signs of aging. These are just red flags that your hormone levels are dropping. And everybody's hormones are going to change at different paces and different rates. We're all going to see a decline in our hormones as we get older, but some people may physically feel that change more than others. And testosterone, I try not to say testosterone is a male hormone, because it's really important in women too. And if you are a man and your wife or your significant other, your female counterpart is also going on testosterone, you don't want to be the one who is testosterone deficient in the relationship. But testosterone is the hormone at the levels that it runs in men that make men feel like men. And so when those levels drop, things can alter, not just your mood, but also your relationship. So it's the silent epidemic. And what's interesting about this term andropause is that I don't know how many of the people on here have actually heard of that term, but we hear about menopause, but we don't talk about it for men. And that's why it's a silent epidemic. But what's really important about andropause is not just about the way you feel, it's also about your health. So we know men who have low testosterone levels have worse health outcomes as well. And we'll talk a little bit about that. But honestly, I think most people are more interested in that strength, confidence, and drive that they had and being able to maintain it. So, what are some of the common symptoms? Extreme fatigue. So, you're dragging throughout the day, even after a full night's sleep, just not feeling like you're waking up rested. Low libido or erectile dysfunction. Now, erectile dysfunction, basically just having a difficult time getting it up, that is not always due to low testosterone. It can be. And so, if you find yourself not having morning erections anymore, I think it's something that needs to be evaluated in totality along with your testosterone. But if you also have other chronic illnesses like heart disease, all of these things can be signs that there's other issues. So you don't want to go to, well, one of the things I see a lot is men who are ordering medicines online, and it's, oh, testosterone is going to solve all your problems. And although it will solve a lot of problems, you don't want to miss really big red flags. So erectile dysfunction, whenever I see that, it's the testosterone and what else is going on. So weight gain and muscle loss. So we see this again, you're going to the gym, but you're not being able to build muscle the way that you might have been able to do when you were younger. So depression and anxiety, I guess this is another sort of silent thing that men don't talk a lot about, but that feeling of being irritable or hopeless or depressed. I remember when I was younger, one of my friends' fathers would sit on the couch all the time. And she said, my parents are getting a divorce. And in retrospect, he probably was low testosterone. There are obviously lots of reasons why people get depressed. It happens at this time in men's lives as they get into their 40s and their 50s. And it's not anything to be ashamed of, no more than it is for a woman who's losing her testosterone in her 40s and 50s. And this is a chemical imbalance. It's nothing wrong with you. It's just that we've got to correct those hormones. And then brain fog and memory issues. I know a lot of women experience this, but men experience it too. Also, part of this was really came out of this idea of having women come in, get their hormones, and them feeling so much better, but their husband's not, and that really disrupting the relationship. It mirrors one another. So if you take a moment and you look at your spouse, whether your spouse is a woman or your spouse is a man, the same things that you might be experiencing that may look different, but it doesn't mean that the other person isn't experiencing it in the way that they're experiencing it. So when you replace the testosterone in both men and women, you both see an increase in that energy. You both see a decrease in the confidence. You definitely both see an issue with connection. And if many of you don't know this, that divorces rates actually go up during midlife. And there's actually a study that says 73% of women who went through a divorce attribute it to going through menopause. And what I thought was interesting is that going back and saying, how was it attributed to andropause? I think we're just not even thinking about it. We're not thinking about both the male and the female are going through a hormonal change and how that affects the relationship between the two of them. So testosterone therapy just isn't about one of the partners. It's about both of them. And that's why it's important to have both partners be tested to make sure that both of them are being replaced with the hormones that they may need to stay thriving and healthy. So what are some of the benefits of getting testosterone therapy? So it's the reversal of the symptoms that you have, right? So what most people say is I have increased energy and vitality. And this is like one of those vague things. But again, you ask yourself, do you feel as energetic, as vibrant as you did when you were 20, when you were in college, and all the dreams and all the hopes that you have? Are those still aflame? Do you feel the same way about your partner? Do you feel the same way about your friends and your activities? Do you want to go out? Do you want to stay engaged? And some people will say, yeah, I do. I still want to have sex and I still love to go out and have a good time with my friends, except it's just not as, I just don't feel as energized. And so that's thinking about it in comparison to how you normally or you used to be. And stronger, leaner bodies. So again, when people think about testosterone, they think about bodybuilders, but it's really not, that's not the goal we're going for. We're not looking for to have excessive muscle gain. We're just trying to maintain the muscle that we have and maybe build a little bit of muscle as we get older. And we can't do that when our testosterone is working against us. So libido awakening. So again, one of the first things that men will see when they start with testosterone therapy is having an erection in the morning and being like, I haven't had one of those in a while. So it just is letting you know that we're turning things back on. Those sensors are starting to light up again. So also thinking and motivation is it's another one that I think gets swept under the rug. It's, yeah, the libido is one thing, but really just having the desire. And I think to be better, to do better, to excel in your life in ways that just you may not be motivated to do anymore. That sense of mental fog goes away once you're on testosterone. And then improved mood, emotional strength, less stressed, being able to handle the stress around you. Life does not get easier as you get older, particularly if you have children and you have spouses and you have aging parents. All of those things are playing a role. Do you have the testosterone that's going to allow you to deal with those things in a way that you feel good about? And then improved quality of life. I can't underestimate this one, because one of the things, and this happens a lot in research, is that we'll say, oh, if it's not actually improving, let's say your libido, that we shouldn't treat it. And if your libido was fine, but your quality of life, your energy, your motivation, your emotional resiliency, all of those things are suffering, the quality of your life, the quality of the relationship with the person that you are in a relationship, the quality of your relationship with your children, all of those things matter. And if testosterone can improve that for you, why wouldn't you let it? And then there are other health, and I talked a little bit about this earlier, but then there are some really important health benefits. So one of the things that there's a misconception about testosterone, particularly around its dangers, is that it actually increases your risk of heart disease. And it absolutely does not. As a matter of fact, we know that men who have low testosterone actually have higher rates of heart disease, higher rates of metabolic disorders like diabetes, weight gain, and then also higher rates of all-cause mortality, which basically means you're more likely to die of anything when your testosterone levels are low. Now, here's the trick. The question is, how do I know if I have low testosterone? Oftentimes people think you need to get a lab, and if your lab in medicine, we say if your testosterone is less than 200, then you have low T. But that's not as cut and dry as people might think. It's not just whether you hit this threshold. If your testosterone was, say, 1,000 when you were 25 and you felt great, and today it's 500 and you don't feel as great as you used to, then that is an example of low testosterone, that your testosterone is not doing for you at a level at 500 that it could be doing at 1,000. And what happens, how would your body, how would your life, how would your health change if we got those numbers up higher? Low T isn't just about a specific number. There are lots of reasons that's the case, but just know that even if you go to your doctor and they're like, okay, we'll check your testosterone and everything looks great, and your numbers are hanging out at a solid 400 and you don't feel great, then you should be looking for additional support. So let's talk about some of the myths. I talked a little bit about this idea that testosterone therapy causes heart disease. And again, it not only helps with, when I talk about heart disease, we're talking about heart attacks, but we're also talking about congestive heart failure. We're talking about all of the risk factors that surround it. So even high blood pressure is one that people often think that testosterone causes. And the thing to know about the side effects of testosterone is that people are conflating the side effects of anabolic steroids with bioidentical testosterone. They are not the same. And we do this a lot in the medical community. We just say anything that has a steroid in it all has the same reaction, when we in fact know that's not true. And I'll talk a little bit about that in a moment. But the idea, if you hear it, and even if you Google it and it says, oh, testosterone causes an increase in heart disease, what they're actually saying is anabolic steroids, the ones that people would abuse at very high doses when they were doing bodybuilding, that can in fact cause heart disease. Bioidentical testosterone, getting your levels back into a nice normal range, does not cause heart disease. It actually improves heart disease. Testosterone will make me aggressive is another myth. So again, this is another thing we're stealing from anabolic steroids. We call it roid rage, where, people who were on these anabolic steroids to build muscle mass, they would get very aggressive. And that is in fact the side effect of anabolic steroids, not the same as bioidentical hormones. And then it will make me look like I'm on steroids. So everybody knows that guy in the gym who looks like there's no way he would have muscles like that if it wasn't being helped. Again, not the same thing. Just for clarity, anabolic steroids are a type of testosterone. They're a derivative where they change the testosterone so that it is more potent for the purpose of building muscle. And those steroids are usually done at very high doses. They usually have additives in them also there to help you like overbulk your muscles, and they are not done under physician supervision. So again, they're not the same thing, and don't give you the same side effects or the same benefits. So why, and I talked a little bit about this as well, why should couples do testosterone together? It's because both you and your spouse, particularly if you're around the same age, when men go through andropause, women are going through menopause, and it creates a better intimacy. It creates less conflict. As a matter of fact, one of the things that is often said by people who, men and women, when they go on hormones, is that it saved their marriage. And that's because think about all the things that happen in your 40s and 50s, all the stressors. And if you are pairing all of those life stressors with the decreased ability to deal with them, more mood swings, less tolerance, less sexual intimacy, less all of those things, you can imagine how people just give up. And they're like, I don't want to do this anymore. And so again, if you're interested in maintaining a healthy relationship, you don't just want one partner on. I definitely don't want my husband on testosterone and I'm over here not interested in him. And I definitely don't want to be over interested in him and he's not interested in me. So it's not just about libido, but obviously that's a huge part for both men and women and their relationships. So the other thing I wanted to bring up, and I'm actually going to talk a lot about this in next week, but for men, I only do pellets. The way that you can get testosterone is through injections. You can do creams or you can do pellets. I do not do testosterone injections in men or women because, as you can imagine, what an injection is, it's you inject yourself with testosterone cypionate, which is not a bioidentical form of testosterone. You inject yourself once a week or maybe twice a week. And whenever you do that injection, your testosterone levels peak, they get really high, and then they go back down. And then you do this sort of roller coaster thing every week, as opposed to with a pellet where you get this steady state. So essentially what happens with pellets, and I don't know if I put the image in, I did not, but with pellets, you get a steady state of testosterone. So what exactly is a pellet? A pellet is a small little thing that looks like, I'm going to come back on screen here, but it looks like a Tic Tac. I wish I would have brought one with me, but it's about this big for men. And we actually place it underneath the skin and it lives there for 5 to 6 months in men. So once you insert it, you don't have to get testosterone again for another 5 to 6 months. It lasts you that long and it gets slowly released over time. And so there isn't this up and down that you see with injections or even creams. It's like it goes up, it gets to a peak number. So your testosterone is now around 1,000, 1,200. It stays there. And in the small changes that do occur, let's say you do go work out, you get a little boost of testosterone because that's going to help you when you're working out. And when you're sleeping, it's going to come back down and you're going to give yourself a little bit less, but you're going to pretty much stay in this nice little steady state until it starts to wear off. And how do you know when it's wearing off? It's because your symptoms come back. So there are lots of men who start themselves or who start on testosterone and this actually happens both ways, where their partner is the one that tells them when it's wearing off, right? You're a little bit more testy, you're a little bit less tolerant, your sex drive is not as vigorous as it was when your testosterone was at peak, and you can start to feel that decline. And when you do feel that decline, you come back in, you get another placement, and then you go through it for another 5 to 6 months. So it's a really great way of getting a stable amount of testosterone that mimics your own body's fluctuations with activity and sleep. And you don't have to worry about these sort of peaks. You're more likely to get side effects, if you're going to get any, if with these sort of roller coaster. And just people love pellets. Men that really love it. It's super simple. You don't have to do a whole lot of thinking about it. The other thing is that I use a specific type of pellet. So if you have ever had pellets before, the type of pellets that we use in our practice are called Avexapel. And the technique that we use is much less traumatic. It is a small procedure and it's really minimal. I mean, I want to say it's painless. The most pain you feel in the procedure is a little prick, like somebody, like getting an IV, but not even as bad. And you get the placement of the pellet, and these specific pellets actually have a little bit of triamcinolone in it, which is a little bit of a small amount of steroid that just helps to decrease inflammation. So one of the side effects of the other pellets out on the market is that your body can push them out, but with the Vexapel pellets, we don't see that. So that's one of the reasons why we use that version. It's bioidentical. Again, it will last you 5 to 6 months, so you only need to have it placed twice a year. And then it's very specific to you. So we do determine our dosing based off of your labs, based off of your symptoms. So we're not just like a one size fits all. So it's a great way to do your pellets. So I think I took the slide out, but I want to make mention. So what are some of the side effects? What are some things that what are some of the things that you should be concerned about? So the one thing I would say is if you are interested in still having children, you don't want to go on testosterone therapy because it will lower your sperm count. Your sperm count will return to normal after stopping testosterone. But if you're a person and you're in that phase of life where you're still trying to have children, that would be the only condition where I would say, no, you may not want to consider testosterone. Prostate cancer is also one of the things that gets a lot of questions. And that's a very controversial one, just like it is with breast cancer. But the reality is that in some cases, testosterone is the treatment for prostate cancer. And in some cases, it's a question of whether or not you have an active prostate cancer and we're putting testosterone on top of it versus you not having prostate cancer. It's not going to cause prostate cancer. So the thing that we have to think about is if you're at the age where prostate cancer is an issue, we go ahead before we start you on the medication, we check a lab to ensure that we don't have any issues. And again, if we do see an elevation in that lab, the PSA, then we may make some adjustments. But again, this is the whole point of seeing a doctor for this and not just doing it over online or doing it on your own. So it's important to be followed. But those are the big two that people think about. The other one is sometimes we see an increase in your blood count. If you have a low blood count to begin with, it actually helps to bring your blood count up, but sometimes it can bring it up really high. And this can be very scary for a lot of doctors who don't understand it. But the raising of your blood count really does not cause any problems. It doesn't cause increased clotting, which is one of the things that a lot of people think. It does not. And so again, if that is something that happens, we're following you and we will address it, but it usually is not something that is very worrisome and does not cause any major complications, which is what we really care about. So what are some of the things that people say when they get testosterone? Before testosterone therapy, I felt like I was sleepwalking through life. I had no energy, no sex drive. My confidence was gone. Within weeks of starting pellets, I felt like a new man. My wife noticed the difference immediately. Again, I'm telling you, if you're interested in building a solid relationship or reaffirming a solid relationship, your significant other is going to be the first one to notice. And then our relationship is better than ever. I didn't realize how much my testosterone was affecting my mood. I was constantly irritated, exhausted, and I lost interest in things I used to love. Now I feel like myself again. I'm happier, healthier. My wife says that she has her husband back. Again, this is about how the quality of your life, not just one piece of your life. We're really thinking about how do we make you healthier for longer. And then for women, a lot of men will go in for testosterone. And this client, I went in with my husband for a consultation. After talking to the doctor, I realized that I needed hormones as well. And then they both started therapy together and changed their marriage. So again, it's important, I think, that this is a conversation for both men and women. It's not just one or the other. It absolutely needs to happen together. So as a result of that, we do have a coupon for couples who come together and decide they want to do hormones together. If anybody is interested in that, we will get that information out to you. So how do you begin to work with us? This is really quite easy. The first step is we get your labs. We do a comprehensive lab panel. Remember, our goal is to take care of your whole person. So we're not just looking at your testosterone levels. We're looking at your cholesterol. We're looking at your blood count. We're looking at your inflammatory markers. So we're looking at all of these things. We're even looking at your thyroid. So we're looking at all of these things and we're going to determine what is the best step forward, what dose of testosterone is best for you. And then during that visit, we place your pellet that day. In 6 weeks, you come back, we follow up on your labs, make sure everything looks good. If we need to make any adjustments, which we rarely need to do, we'll do them at that visit. And then we see you back in another 5 months. If you're a man, and another 3 to 4 months if you're a woman. And then that's really it. And if you need additional support, we're here for you for that too. So if you're interested in more information specifically on pellets, if you scan this QR code, it will take you to a nice little video where this lady is nicely talking about pellets, because a lot of people don't know very much about pellets. And so this is our way of educating people on that procedure and what it looks like and what you would do, what you could use it for. So a little bit of what we talked about today, but I did want to open it up. I have hit my 30-minute mark and right on time. So I want to be able to answer any questions. If you have any specific questions about hormones for men, hormones for women, testosterone, anything you've ever heard about testosterone that you think that maybe I didn't address today that you still have questions about. But I will finish up here, and you can either type your question in the chat or you can just verbally tell me. And if not, we will conclude. So and when you registered for this, you will get access to the replay. And of note, the next week we'll be talking specifically more about pellets. So if you're interested in what that looks like, we're going to be talking about that next week. And then we're going to be replaying this series. The first video that we did on this series was just about hormone replacement therapy. The second video that we did was about testosterone in women. Third was about the role of hormones and cancer, particularly breast cancer. And then this is our fourth one. It's about men and hormones. And then the next one will be about pellets. Now, if you guys have any other things that you guys are interested in knowing, then just let me know and I will make a video for that. Can you explain more why you don't recommend creams? Oh, yes. I didn't actually answer that question. So creams, there are a couple of reasons I don't like creams. Number one, the absorption isn't as great, so you don't get as big of an effect. Number two, the amount of cream that you need for men is a pretty extensive amount. It's just not as effective. You have a lot of cream to rub in, and it gives you a greater risk of transfer. So basically what that means is that if you are getting this very high dose of testosterone that is meant for men, you can transfer that testosterone over to your significant other, to a pet, to children. And so creams for men aren't as great of a choice. Most men who aren't doing pellets are doing injections. The problem with injections are exactly what I told you. It's that fluctuation up and down. And then the other thing with creams is that they are also it's a tedious procedure. You have to do it all the time. So you've got to do it daily or even twice a day, as opposed to a pellet where you put it in once every 6 months. So to me, it's a real no-brainer. Yeah, so could I go into some more of the health benefits beyond mood, energy, libido? So the biggest one that we talk about is heart disease, because there's a lot of research. The issue with the research in heart disease is that, and why some people think it's dangerous, one's because we're using the ideas of anabolic steroids, but it's also because of how the research is done in men and cardiovascular disease. So what we're actually see when we've looked at testosterone at the doses that we're giving it with the right hormones, we actually see a decreased rate of actually cardiac events. So that means less heart attacks. We actually see improvements in congestive heart failure. So people who have weakening of their heart, less arrhythmias, all from having brought your testosterone back into level. Another really great benefit is going to be metabolic health. So when we talk about things like diabetes, so this is another very common disease that people associate with aging. It's inevitable. Part of that comes into play because our testosterone levels are so low, but also because we're replacing our muscle with our fat. And so what testosterone does is it helps to maintain our muscle mass and helps us keep some of that belly fat, particularly the more toxic belly fat that can be found around the organs. It helps us to limit that. It also plays a big role in inflammation. So it actually decreases inflammation as well as lipid markers. So things like your LDL, your cholesterol levels, that's the word I was looking for. So cholesterol and triglyceride levels, you actually see a decrease in those markers in a healthy way. So what we do know about cholesterol levels is that we can take medicines that are prescribed, like statins, to actually decrease. Most men or most people who have high cholesterol take medications for this. But what we now know about our cholesterol is that we can reduce the level of our LDL our bad cholesterol and actually not see a benefit in cardiac protection. But we know that when you actually increase people's testosterone to a normal level, you decrease their LDL and also get the cardiac benefits. So that's just another great thing that we see. We see a decrease in our cholesterol levels, improvement in metabolic health, improvement in weight and the distribution of fat to muscle. And we also see an increase in bone. So bone health is also really important. It's not as prevalent like osteoporosis, the disease of brittle bones that causes you to break bones as you get older. You don't see it as frequently in men because men tend to have higher testosterone levels than women, but you still do see osteoporosis as men get older. And you can think about also just thinking about as men get older, you see how we lose our height. When we lose muscle mass, we lose height in our bones. All of those things are driven by the decline in our testosterone as we get older. So by maintaining that testosterone, we also will maintain that bone strength and our physique. A lot of people only check total testosterone. So yeah, so understanding, having a doctor understand how to check testosterone. So I touched upon this, but didn't get too deep into the idea of how do you know if your numbers are normal or not? And if you went to your doctor and you had your testosterone and they said, yep, you're fine. So oftentimes people are only looking at your total testosterone, and your total testosterone is not the best marker for determining your testosterone levels that your cells have access to. So you really want to look at your free testosterone in men. But the reality is that the more important than your labs, and I say this for women as well, is not just that level. What would be great is if I knew your levels when you were 20 and I could compare it to what your levels are now. So that would be helpful. But what's also very important is if you are having the symptoms that I described, if you are having issues with mood, libido, energy, muscle strength, you find that your muscle mass is not what it used to be, all of those symptoms, and your testosterone level is a 500 or a 600, that doesn't mean you don't need testosterone. And if I give you testosterone and those symptoms go away, that's confirmation that the testosterone was there to help. And because we know that the harm is so low, why wouldn't you do it? It doesn't make sense to not feel better and have all of the health benefits that come along with it. There would be no reason to not do it. So what are some of the potential side effects? So yeah, I've named them. They're not a lot. I know it seems like, oh, what should I be worried about? So the ones that I named. So if you're interested in getting pregnant, it is going to cause your sperm count to drop. That's an absolute problem if you're interested in having children. So you don't want to do that. And if you are a person who wants to have kids, and you are going to start testosterone, but you're not ready to have kids, you need to know that you need to give it at least a year. So that means you want to stop the testosterone a year before you want to have children. Your other side effects that are common are increasing your blood count. Oftentimes people assume that increase in blood count leads to blood clots, but that is actually not the case. And so people may see that their hemoglobin, that's the blood number that we're looking for, go up to really high levels. So things like 17, 18, a normal being around 14. A lot of doctors would be scared of that, but the reality is that you don't actually have an increased risk of cardiac events, meaning heart attacks or strokes, even at those high levels. And it is not the same thing as a disease of your blood count, something we call polycythemia vera. It's not the same thing as having your hemoglobin rise because of testosterone. So hair loss is it's not testosterone itself that causes hair loss. It is a derivative of testosterone called DHT. And in the event that your DHT levels go up and you end up having things like acne, which we don't see as frequently in men, but if you do have that or you have associated hair loss because of that DHT, then we can do certain things to help treat that. So there are certain medications that we can give to support that. The other thing that we sometimes will see is that testosterone can in fact it gets converted into estrogen. And this is not a bad thing. You need estrogen as a man. So getting that conversion is not a problem. But sometimes if you're over converting because you don't have a good diet or you don't have good gut health, what ends up happening is that you can develop breast tissue. And again, this is all reversible. And sometimes you may need to take a medication to help reverse that and just lower the dose. So these are things that we call nuisance effects, side effects, the same in women. So they are things that can come up, but they are things that they're not irreversible. They're all reversible, and they're all things that we can do things about. And if you are starting to see male pattern bald hair loss, The other thing is that often people tend to forget is that there are other things that cause that, and some of it is not preventable. For example, if you genetically are predisposed to losing hair, the testosterone is not going to increase that, and it's not going to slow that down either. It's definitely not a hair loss remedy. Although for women, you can start to see more hair growth. And even in some men, you can see more hair growth if your testosterone is just elevated and your DHT is not. Any other questions? Those were really good questions. Thank you, guys. All right, fabulous people. It was wonderful talking to you guys. You guys have a good night. And let me know if anybody is interested in, thanks, Hamilton. If anybody's interested in meeting with us, you guys know how to reach us, and we will reach out to you as well. So talk to you guys soon.